Oh my God, we're live!
We are live as he runs away. Hey. So, this is Erin. Hello.
He's got to dance back in.
Oops, where you at? Obviously, a lot of things are going on in this world, and every year there's always a need. Well, every time, if possible, there's always a need to help out others, and especially now with COVID-19 makes extra life super important. And of course, before we talk about what extra life is, for those who are just tuning in and don't know what it's about, as I try to get my breath back. Wow, I feel like an old man. Maybe I am. I'm like 50 something or whatever. Erin McDonald here, who is from Cook Children's. I mean, what's going on in the hospital right now as far as the status and everything with COVID or whatnot? Is things getting better? That face says no.
It's an ever-changing field at the hospital. Um, Unfortunately, with the state of everywhere, everything that's going on, COVID cases on the rise, we have to continually be on our toes, ready to change at a moment's notice. But the hospital over at Cook Children's, you can see it behind me. There's peaks right there, our special peaks. So in the hospital, we have so many different factors that play into what's going on in daily life. And we have an entire command center that is dedicated to COVID-19 and understanding and putting out factual information. And if you go to the Cook Children's website, literally up at the top, there's a big orange bar. If you go to cookchildrens.org, there's a big orange bar up at the top and it says COVID-19 updates. So it gives you resources, education, tips about going to appointments, visits, different screenings, how you can help. There's so much that is put into here. And they use this command center to not only educate the public, but to educate us at the hospital as well. Being a non-clinical role, which means I don't give direct care to patients, I'm not in it as much as our child life specialists, our nurses, our doctors, the practitioners, everybody at the hospital. Since I'm not in it every day, I need to have that update, and we have wonderful information that comes out that helps me inform what I do in my daily life as well. We've moved from, at the very beginning of COVID, we had only one caregiver that was allowed to be in the hospital with kids. And I don't know if you saw the video, but have you guys heard of Dancing Dad before?
I've seen a couple of interviews that was in the Extra Life Stream Kit, which you can get on extralife.org.
Yes.
There was a couple where there were interviews with parents talking about their kids and what they had to go through and all that. I don't think I've seen the Dancing Dad one.
Well, you should definitely take a look. So this is at the beginning of COVID, a young man named Aiden was diagnosed with cancer. And so going into the hospital for treatment, only one parent could be with him. So mom is a nurse and mom would take him in for his treatment. And dad was there the entire time, but he wanted to make sure that that Aiden knew that he was there. So he stood outside in the parking lot and danced for the entire time that he was inside watching. And so Aiden would go to the window and he would look out, and his dad would be wearing these bright, like flames pants. Like, you know, when you used to see on like the classic hot rods, those big, huge orange flames, that's what his pants looked like. So that he could tell. I mean, I don't think there's very many people that would be dancing in the parking lot. And then Aiden would dance in his room while his dad danced outside. um, sweet, sweet story. And it was his way of connecting when there was only one parent. Because I don't know how I would deal if it was just me being able to take my child in. I rely on my husband a lot for that emotional support and stability because I can cry at the drop of the hat. And I'm much more emotional. Where he is emotional, but he's a lot more steady. And so I rely on him for that balance. And so these parents that are having to go it alone, they have so much strength and resilience. But recently, we opened it up to where there's now two caregivers. We've increased the amount of cleaning that goes on at the hospital. Our environmental services, they're cleaning high touch areas at least once an hour. And that is incredible because there are a lot of high touch areas in the hospital. We have over 1 million square feet in Cook Children's. That's a lot of area to clean. And that is deep cleaning, making sure that everything is good. That's bathrooms, that's doors, that's, in our, just our general areas like the Starbucks, the going in into Chick-fil-A, or just our general food cafeteria area. Which if you haven't eaten there, we actually have some really good food. It doesn't taste like hospital food. It's legit, actual good food. So we've been able to open it up and have two caregivers now, which is fantastic. And we're starting to really get into a groove, find a new, I don't want to say like a new normal, but it's kind of like a new normal of what life looks like today. And really just making sure that we're there for the kids. And we're in the process of everybody getting big, huge buttons with your smiling face on it, because behind a mask, that's really scary for kids. And so if you're sitting there like this, let's see if I've got my little, like this, you can't tell really if somebody's smiling. And so, we want to make our kids feel loved and secure. And so it's little things like that that we're trying to do to make sure that we are presenting the best of what we can do for these kids. We have several rooms that are isolation units that are for kids that have, COVID, or kids that have other infectious disease. So that means it's an entire unit that is confined and contained, where they have their own bathroom. They've got the special HEPA filters for going in and out. And we will be working on getting some more of those. So that way, should anything else like this happen in the future, we will be well stocked and ready on different rooms that are capable for handling such pandemics. But it's amazing watching the doctors and the nurses and how they respond and the joy that they bring. And in our hospital, Rihanna, I know you're not a fan of dogs, but we do have 7 therapy dogs. And these dogs train for 2 years to come into the hospital and be facility dogs. Our newest one, named Zuni, she is trained in over 40 different commands to work with our behavioral health kids. So our kids that come in and either do, day classes, group therapy, or inpatient, because right now behavioral health is something that we really need to focus on as a nation, as a community. Fort Worth in general, DFW in general, we're seeing a lot more instances of mental health issues, specifically like suicide attempts. And we're seeing this due to a lot of what's gone on in the pandemic. Kids aren't able to get out there and be with their friends, and there's a lot that goes on at home. And if you already have a bad home situation, then you're stuck at home. On top of that, there's a lot of factors that go into that. So there's so much that we are doing at the hospital. We're changing over a lot of our ED rooms to become more mental health friendly. So making sure that they're ready for like suicide watch. And that's actually, we started that before the pandemic. So we were really ready for when things like this happen. But those are some of the main things that are going on. We're going to be continuing to give the highest quality of care. We're going to continue doing what's best for the kids in our community, and really just pushing forward and making sure that we have resources, education. We've got our case management. Um, as of right now, you know, when more people are losing their jobs and not having that stability, we have our case management that is able to actually go in and provide resources, help out with gas cards, meal cards, making sure that they've got a place to stay. There's so many different instances for what our case management does. And they help with charity care, because when you don't have insurance and your child is sick, you still have to get treatment. And we treat the child first, regardless of if they have insurance or not. You come in, you're going to be treated, and you're going to have the highest quality of care without even knowing if you have anything, you know, for insurance or ways to pay. We deal with that later, because the most important thing is the health and security of that child that has come through our doors. So
Yeah.
that's a big update from us.
I mean, that's a massive update, because last time when we were talking about this, we were kind of predicting whether or not, and this was probably in the spring or close to the summer of this year, we were predicting whether or not it will get worse or better later on. And now the reason why I was on the edge of, yeah, I don't know what, stop and what, oh, okay. I was like, who the heck is that? Oh, no, that's Rihanna. But there's like I'm not really trying to be or on the negative Nancy, but through halfway in, I felt like things were not going to get better, because I guess I was just seeing so many instances of people just not paying attention to the things, and just kind of blowing it off. And that still happens. Like even at my job, I get nursing students who come up and they pull their masks down just to eat or just to chat, and try to get real close to me, and I have to tell, hey, 6 feet apart, mask on, and they keep forgetting that. It is kind of scary when you think about new nurses coming in. Are they going to be able to handle this? And I'm not using these students an example of, okay, all nursing students, they don't get this virus, but the fact that they are out there, and you're seeing cases keep going up, and predicting that by the winter it will be even worse. And I'm trying to put things on depressing, and just kind of to keep people aware. I mean, where do you see the hospital going in just within the next month or two?
um, I mean, that is so hard to predict. Tough question. Thanks for asking, but tough question. Um, I see us continuing to leverage the data that we have, the data that our physicians put together, and putting out information to make sure that we continually provide that amazing care. It is important to wear your mask. We get information about that every single day. When you look at the statistics of, if one person's wearing a mask, there's still that 30% chance that another person could, you know, get COVID. If neither one is wearing a mask, I mean, the chances are much, much higher. If both people are wearing a mask and one person has COVID, it's down to like a 5%. Don't quote me on those. I'm remembering off the top of my head. Be sure and fact check everything. That is big. Make sure that you fact check, and make sure that you remember that this world is just bigger than you and me. This world has so many people in it, and we have to remember in our hearts that we are here not only to care for ourselves, but to care for others. And I know that not everything is altruistic in the way that we do things, but we have to remember that this is bigger than you and I. This is bigger than our circle of friends. This is bigger than that. This is about raising our next generation and providing the top of the line medical quality care that they need to be able to run our country later on. And we want to make sure that we provide them the mental health that they need, the amazing support, resources, education, everything that they need to become productive citizens later on, whether that's dealing with asthma, whether that's dealing with different mental health issues, whether that's dealing with leukemia or any of neuroblastoma, any of our childhood cancers. We want to make sure that we're providing that care, and we are going to continue that care, and we're going to continue increasing that care. We are always looking for the next way to change what we do to make it better for our kids. Our patients are at the heart of everything that we do, and we will never, ever change that. Our patients will always be the top of what we do and will always be at our heart of the decisions that we make and anything that we put out there. It is to make sure that we have the best support of our community. I mean, we're the only company that is working to go out of business. I mean, you don't hear that. We want to, if we were out of business, that means that we wouldn't have childhood cancer anymore. That means we wouldn't have kids that have broken legs or mental health issues. If we did not have to exist, that means that our kids are healthy. But until that point, we are here. And we are here to provide that care. And we are here to make the lives of our children better. Wherever they live, they don't have to live down the street from us. We have people that come in from New Mexico. We have people that come in from all across the country. Our teddy bear transport, which has 2 jets, a helicopter, and a fleet of 15 ambulances. We don't go to sites of like car accidents. We go to facilities and bring these kids in to ours. So we've actually done international travel where we go and we pick up kids and bring them to our hospital because we have the care that they need. And that's where we work with other hospitals to make sure, because ultimately, if you're at a pediatric institution, those doctors and nurses, they want that kid to get better. And wherever that kid needs to go, that's where they need to go. So we have a level 4 NICU, which is the highest level of NICU that you can have. We've been double certified as a level 4 NICU. One of very few children's hospitals in the entire world that has that accreditation. Our simulation lab was just certified, being one of the first simulation labs to receive a worldwide accreditation, first in the entire world to receive this accreditation. And it's amazing. Our simulation lab, we put in so many hours on all of these medical dolls to make sure that our nurses and doctors are trained. And so that's going to continue. Even in the next month, they do so many different, just situational training on what could happen. So a lot of it revolves around that respiratory care right now and what that looks like, infectious disease control. And our nurses and doctors go in and they spend time in this simulation lab to really hone in on their skills and to define their skills. And that's a safe place where they can say, okay, if this happened in the real world, this is what we would need to do. And it's a safe place to say, okay, if we did this and it went wrong, this is what happens. So they can play through those experiences. And that is one of the amazing things about Cook Children's is the care that we put into things. And I only see that increasing with everything that is going on.
So there is one thing that just popped up. It went viral on TikTok, and I don't know if you. I mean, being that you're not like in the or at least you're not. You're kind of outside. You're not inside, like having to put on the surgical mask and do the most of it. But there is this thing that's been blowing up, or not blowing up. It's was on TikTok where I don't mean to kind of get into the whole race thing, but there was a black woman on TikTok talking about hospitals kind of treating people of color second. Uh, I don't know if you have a response to that, but it was something that was making the rounds about the thing was that Black women are facing on the hospitals where they're not getting any treatment, or at least they are kind of pushed aside for other people who are not, or doesn't look don't look like them. I
Okay.
hopefully that is not the case with Cook Children's.
Well, I have some amazing news for you in response to that. We have just hired um, a chief development officer or a chief officer of diversity, equity, and inclusion. So her job is to make us better together with diverse perspectives, more inclusive ideas, healthier outcomes, creating stronger communities. And her whole job is around diversity, equality, and inclusion. And that is what she does for the hospital. And it's making sure that we celebrate that each person is unique, that we embrace all people, regardless of our race, ethnicity, gender identification, sexual orientation, disabilities, religious practice, or socioeconomic status. So you can actually go onto the Cook Children's website and read about this. And we've got an entire page dedicated to the diversity, equality, and inclusion um, of what we are doing at Cook Children's. So there are so many different pieces to this. And our, let's see, her title is actually Chief Diversity Officer. That's what it is. And her name is Winnie King. And she is absolutely amazing. So I encourage you to go and look about that. They have several different things talking about race and talking about the culture of care and how we are working to make sure that we are as inclusive as we can possibly be, because every child deserves to have the same level of treatment. Every single person out here needs to have that level of respect with somebody. When I enter into a conversation with somebody, I make sure to check my own understanding of that person and make sure that I give them that listening ear, and that I'm not listening just for the next thing that I'm going to say, that I listen to actually respond to not only their verbal communication, but their nonverbal communication, because that's so important when we're speaking with somebody. And Cook Children's is moving into, we've always been inclusive in what we do, but we are having a more direct and concentrated effort in that arena. And so I encourage you to go and look at it. If you just go to the cookchildrens.org, you can actually look at the diversity, equity, and inclusion page that has so much information and talks about all of the things that we're doing, in our Center for Children's Health, our neighborhood clinics, making sure that there's affordable care, advocacy, our homeless initiatives, working on mental health, different things about talking about race. So it is so important to learn about what's going on in our community, but to check our own biases as well, and to know when we have, this is me speaking, not the hospital, this is me, Erin McDonald speaking, to know when we have a bias walking into a conversation so that we know we can check that bias and set it aside so that we can move into deeper conversations with people, because we are all human. And we have to lift up every single person. And those that don't have the same privilege as us, we have to work to raise them and elevate them to that level where they have that same opportunity. And I see that in my work, and I see that in what I do at the hospital, and I will continue to do that. And I hope that people will continue to check me, that if I ever say something that is non-inclusive, I hope that they call me out. And I hope that they say, Erin, that's not okay. Or I know you didn't mean it like that, but this is how I took it. And I hope that we as people can continue to grow. And I know that our patients feel that way, that if a nurse or a doctor or a child life specialist says something and they take it wrong, I hope that our patients know that they can tell that staff member and say, I don't feel comfortable with the way that you said that. And it's never meant in a harmful way, but sometimes our words can get jumbled up when they come out. But our staff is at a point where they can receive that and say, I'm sorry, I will change the way that I communicate. And that's what Winnie is working to do with our staff, is making sure that even though we may not mean something, if it comes out one of those colloquial phrases that may have just wrong connotations, that we can check ourselves and say, you know, that I need to take that out of my vocabulary. And so we are really, really working on that. And it is such a beautiful thing to see that we are working to elevate all races, all cultures, religious, sexual orientation, whatever it may be. We're working to elevate them and make sure that we have that same level of care and commitment to every person that walks through those doors.
That is great. I mean, it's a very important note because that is something that's been blowing up recently, and it's great that you address that head on. Uh, Now, before just getting right into, because we got almost 15 minutes, let's. I wanted just one more hospital related question that's important. I'm not trying to get this whole into politics, but uh, there's a likelihood that President or Biden, he's going to become president. And one of the things he said, and that's one of his first lines of order, is to have a full blown lockdown. Now, over in other countries, they're already on lockdown number two, but we haven't gone into a second lockdown. And there are people who are worried about it. I mean, of course, the a lockdown does come at the cost of small businesses and certain jobs that require to be have some sort of in-person presence. But do you think that having a full-blown, almost Paris-like lockdown is going to put it into this COVID? How, I mean, the fact that you mentioned there is a percentage of people who not wearing masks and doing all that thing, and having something like this that's going to force them, or at least put in a way where they can't go out without getting in trouble for not wearing a mask.
Well, it's hard to tell because we don't know how people will respond to anything like that. We also don't know how people will follow directions. All I can do is direct people to the research that is being done. If you look out there and look at how masks prevent the transfer of diseases, that is why doctors, if there's an infectious disease patient, that's why they wear those N95 surgical masks, to prevent that infection from coming into their system. It's proven, scientifically proven, year after year after year. It's not just a pandemic, though that heightened things, but we have that data out there. And I urge people to read the data that is coming from hospitals, read data that is coming from the CDC. Make sure that you are using those credible sources to formulate how you respond. And the honest answer is, I don't know. I don't know what it's going to look like, and I don't know how it will affect it. And sometimes we just have to go with the I don't know answer, because I don't. I can speculate all I want, but all I can rely on is the data that is put in front of me and the data that is put out by my hospital that says masks help save lives. That's the basis of it. Masks help save lives, and they help keep us safe. They help keep my son safe. My son, who has he has asthma so severely that, you know, if he were to get sick, this would be incredibly bad. My 8-year-old wears a mask anytime we go out. My 4-year-old wears a mask anytime we go out. They just know when we leave our house, if we go anywhere, there's a mask that goes on their face. And that's not just to protect them is to protect other people as well, because I care that if I have, the common cold, I'm not breathing on somebody and giving that to them, and they may have an immunocompromised system that would make their issues get even worse. So we just have to protect not only ourselves but our others that are around there. And I have no idea what it will look like, but I know that the data says wear your mask, stay that 6 feet apart, make sure that we are taking into account other people out there, because the children that come into my hospital, they they don't have the same luxury of being healthy all the time. They're coming to our hospital for a reason. And so I want to protect them. I want to protect the kids that walk through our doors. And that's my job. And that's my promise to them, is that I will do everything in my power to protect them, just as my own children. Because the kids that walk through the doors of this hospital, those are my children as well. Because I made a promise when I joined Cook Children's that I would protect the lives of our patients as well. So it's hard to tell. All I know is just rely on the data that comes out. Rely on the data that comes out from our credible sources. Fact check everything. Make sure that you're getting the correct information. Make sure that you're putting your bias aside and knowing that we are here, especially at the hospital, we are here to serve the greater good and the greater community. And we're here to help the children that walk through our doors, our patients and our families.
And couldn't say it better myself. That's a very powerful statement, and why I think something like an extra life is important. As when I interviewed you, we talked a whole great deal of extra life, but the basic rundown is that 24 hours. Me and Rihanna's job is just to make whoever comes here put on a smile, put on laughs, but also uh, to raise money for Cook Children's. 10,000 is the goal, and we're not the only groups doing it. We got other groups that are also going for that race. But the other priority for me, at least for this year, is to mainly inform other people about Extra Life who don't know about Extra Life. And I think what's interesting is this is a charity all about celebrating the fun of gaming or the fun of entertainment, and just raising that funds for these hospitals. And there's even an incentive for those who want to reach those milestones. I mean, they've been putting it out. Extra Life has been putting out that you can get some special rewards for reaching a certain amount on your goal. Like they just came out and said, I don't think it was a laptop. It was some big suitcase.
The light box that just
Oh,
came
the
out.
light box. Yes.
Yeah, there's a new light box that from the 6th until I think the 23rd or something. I have to go and look at that. You could get a light box, an extra light box for raising $250. Um, when you get to $500, you get a silver medal. 1,000, you get a gold medal. If you raise 5,000, then the first 200 people to raise that get this amazing gaming chair. So there's a lot that is going on, and especially with Extra Life, kids can't wait. Kids can't wait for the pandemic to be over to get treatment. They need treatment now, and we need to make sure that our hospitals are ready. And the beauty of Extra Life is you can game anywhere, and we can show the power of gaming and the power of the support our community has on these hospitals.
Yeah.
And you get to choose the hospital that means the most to you, the ones that you have connections to. I could have somebody playing for Cook Children's that lives in Seattle. And that's the beauty of it. We game anywhere, and we game for the hospital that means the most to us.
And the interesting thing about this is that this year we'll have guests who come from countries where Extra Life is not even supported there. Because the thing is, Extra Life is only in America and it's only in Canada. And at 11 a.m., we'll have Winnie Ama, a gorgeous, amazing lady who's a talented singer. And that's where we'll also have Rihanna's favorite guest, who she's excited to see, and who she will treat like a real companion. Yeah, Rihanna, I'm looking at you. You're gonna be nice. So, but she's from the UK, and there's no Extra Life in the UK or in Ireland with Sylvie Demai being our big musical performance at 3 p.m. So even though this hour is dedicated about Extra Life and about the hospitals, I'm somewhat repeating a little bit of this over to them because they don't know, and it's interesting. Like the charity, at least at this point, doesn't support hospitals over there. So the question you have to kind of answer for them is like, what do they get out of
Well, I mean,
it? Yeah,
we're helping our next generation.
yeah, and yeah,
These kids could stay in the United States, they could move to the UK, they could be in Ireland later on, and these are people that will be, these are kids that will be running our world and working to make the world a better place. And if we show them that kindness will be repaid later on in life. And I think right now more than anything, the world just needs kindness,
yeah.
and we need to remember that. And so though we may not have those children's hospitals and Extra Life overseas, they're still making an impact because they're supporting you, and you're so passionate about helping kids at Cook Children's that they're supporting you, and in turn 100% of what's raised comes to the hospital. There's nothing that's taken out of that.
Yeah.
Whatever comes into your Extra Life page comes directly to the hospital. I don't know any other charity that does that. There's no other charity out there that 100% goes to what is raised. And that's amazing. So you know that you're directly helping these kids. And ultimately we're helping kids to grow up and to have a good life.
Yeah. Yeah, no, I definitely agree to that, and I think they're on that same page too. It's just that like they're over there, they're dealing. I mean, there's sickness and a lot of issues going on overseas too. Like we're not the only area that's dealing with kids with disease and COVID-19 especially. That's why I mentioned UK and Ireland. They just went into a second lockdown because it blew up over there, and at least their leader has some sense to protect some other people. But hey, you know what? That's where hopefully things work out with this whole thing. But uh, yeah, so I am just very excited for what we have going on and the ways we are just to bring the fun back, and also keeping in mind of Kirk Children's because they're ultimately the goal this year, even if it is primarily not 10K, but to have even more people be aware of this, so that next year, uh, in case worst case scenario, there's more people supporting this. And I mean, as you especially said, things go. I mean, you can still raise money post game day. I mean, you can keep supporting Extra Life uh, till the December 31st, even. Even though, yeah, we're going all out on this one 24-hour stream. There's still, uh, if we want to do something over the holidays or through New Year's,
Absolutely.
yeah,
It doesn't end, and kids care doesn't end. We take care of kids every single day. We're here, we're for the kids, we're showing the power of gaming, and that's what we get to do. We get to show people that gaming makes a difference, whatever that means to you, whether that's tabletop, console, PC, whether that's playing Go Fish with your kids. Gaming makes a difference, and it brings people together, and that togetherness means that we have a greater impact. So I know you guys got to get ready for your next guest,
yeah,
but I wanted to thank you
of
so much
course,
for bringing me on. And it's just,
of
you
course.
guys are doing amazing work. I am so proud of you.